Great. Hi, Dr. Bean. Welcome to the Genetic Genius. I'm so excited to have you today as a guest.
Yes, thank you for having me. This is great.
You're welcome. I'm so excited for us today to talk about infant health and vaccinations. But before we get started and jump in, can you just talk a little bit about yourself, who you are, what you do, and your place and impact on the planet?
So my name is Dr. Taylor Bean. I am a naturopathic doctor in British Columbia, Canada, just outside of Vancouver. Um, Pediatrics vaccines was not where I saw myself going when I graduated. More athletics and pain management is where I wanted to go.
Mm-hmm.
So what happened essentially is we moved away to Dubai once we graduated,
Oh, wow.
and got pregnant.
Mm-hmm.
Then we moved to Singapore where my son was born.
Mm-hmm.
And in Singapore, there's mandated vaccines.
Mm.
So when I got into practice, because I had a child, I started to see more children in my office as a result of that,
Mm-hmm.
and which I adore. I adore seeing children. This is pediatrics wasn't my focus, and now it is my focus. I love seeing kiddos, and
Mm-hmm.
along with that became the vaccine conversation
Mm-hmm.
as a result of living in a country with mandated vaccines. So I had a couple different scenarios of families that came in who had vaccinated their
Mm-hmm.
kiddos. They had some adverse reactions, which were mild to moderate. In Singapore, you can see specialists quickly, and so they had seen
Yeah.
several people whom had no answers for them. So they came to see me as a last stitch effort. As a naturopathic doctor, it's like, maybe you have something different to provide.
Yeah.
And when they came in to see me, I had no answers. I had no idea what to say or do. And I was a new grad.
Mm-hmm.
And when you're a new graduate, you think you know everything. You think you can fix it.
Right. Totally. The magic is
So,
in everything you do.
exactly. Like, I got this. I know what to do. I know everything, which is so not true at all. Because as we all know, when you get into practice, you learn, fail, learn. And so
Right.
I was a new mother, and as a new graduate, I felt embarrassed that I
Mm.
didn't know what to do. I didn't know. I
Mm-hmm.
didn't have any answer. I had no idea. I don't. All I know about vaccines at that time is, yeah, you give an antigen and it makes an antibody, and that's it. I mean, that's pretty
Right.
much all I understood about it. And there's a schedule, and there's infections that you're vaccinating to prevent. And so it happened twice, and so as a result of that, it's like, okay, it's only two people, but it hit me hard enough where I really needed to understand the product
Mm.
better,
Yeah.
and how the body responded to this product, and what does it mean? What happens as soon as it's injected, and what immune response, and what happens from there? And um, there are adverse reactions. So why? Like, what does that say? How did that happen? Can I prevent any of that if even it's mild, moderate? What would I use to do that? And that's the journey that I've gone on. And so I've been home now almost 5 years from Singapore,
Mm-hmm.
and arriving back in British Columbia. Us naturopathic doctors can administer vaccines. It's
Mm-hmm.
part of our scope. We're the
Yeah.
only province in all of the country that can do that. So I took the course, and now I'm one of few within British Columbia that vaccinates.
Mm-hmm.
And so with that comes transparency and conversation. I've from that experience in Singapore and now in British Columbia, what I have found for vaccine optimization has been the relationship with the parents, and
Mm.
giving the safe space to talk about vaccines. For interestingly enough, that is not available to
Hmm.
people, is having a safe place to talk about vaccines, which is really to me quite interesting. Because why not have
Yeah.
a
Right.
candid conversation? Ask me anything, and I'll
Mm-hmm.
answer you in a very respectful way. And so
Mm-hmm.
the feedback I was getting from parents was, we went to ask questions, and they're just very flippant with their answer. They seem very upset that I was asking any questions. And some of the questions I get are, can you split the MMR vaccine? And I
Mm-hmm.
could answer that question such as, ugh, obviously you can't. That's a ridiculous question. I could answer it that way.
Right, totally.
Or I can answer it as, no, that's a really good question. I get asked that a lot. You cannot in Canada, but did you know there are other countries that do offer just an MR vaccine or a
Mm-hmm.
measles vaccine? And having lived and worked overseas, I still have international patients
Mm-hmm.
where they're moving to that country that offers that solo vaccine, or they're moving to the country that has it's a 2 combo. I'm like,
Mm-hmm.
oh, wait, I'm moving to France and they offer an MR vaccine. Interesting. I didn't know that that was available there. Well, believe it or not, we're moving there. So I never know the situation of my patient.
Yeah,
Um, you know, you the world is small, and you never know, they're
totally.
moving here, someone there, like, oh, my friend's moving here. That's interesting that schedule is different. So
Mm-hmm.
I like to have that full transparent conversation and help them be informed about that. So that's, for me, the vaccine optimization started, yes, the experience and not understanding
Mm-hmm.
what I was dealing with, but more so now it is the relationship that I have with my patients when we talk about vaccines. And I mean, I got patients who they've very basic questions that you could just easily find on, the BCCDC or the CDC, but
Mm-hmm.
they want a person to talk to,
Right.
that back and forth conversation. Believe it or not, people want to talk to each other, and get that feedback, because some of the questions that they ask actually they move to another question that they weren't even thinking about.
Mm-hmm.
I mean, you don't know what you don't know. So, this is where when patients make an appointment with me to talk about vaccines, they must
Mm-hmm.
submit all of their questions beforehand. So then I have an idea of, where is this conversation going and what exactly do they want to know? Or I need to do a little bit of research beforehand.
Mm-hmm.
Um, so, and I can see which way they're going. I mean, I have a lot of patients that vaccinate. Yes, there's patients that have come in already no, with the notion they're not. So, I am not going to dismiss them and ask them to leave. I am here as a naturopathic doctor. We're here to support our patients and
Mm-hmm.
do the best we can and guide them within their journey. I tell my patients, I don't care what choice you make. I don't care. It's your decision. What I
Mm-hmm.
care about is that you've walked away informed. So you make a very informed decision. I don't care what the decision is.
Right.
It's not me. It's not my body. It's not my child. But
Mm-hmm.
just make sure you're informed,
Exactly.
whichever way you go. And so that kind of, people usually leave with more homework, with more reading,
Right.
which is,
Which is okay.
which is okay. This is why I really ask of my patients to do the work. Ask me and I will tell you. There's things that aren't out there for me to tell you, but there is. And so I'm not, I'm not there to tell them what to do
Mhm.
ever. And so
Right.
sometimes that's frustrating because people want me to tell them what to
Right.
do.
Yeah. Be like, tell me what exactly. Yeah.
What should I
Mhm.
do? And it's like,
Right.
no, no, no. This
Here's the
is
information because it's a big
here's the
decision.
information, and
Yeah.
you make that informed decision of what
Right.
you're going to do.
Mhm.
And because you need to deal with if there's a consequence, you're the one that needs to deal with the consequence, not
Mhm.
me.
Right.
And have vowed to myself, I never want anyone to come back into my office and say, you never told me that. And
Mm.
so this is why I preemptively, you have to formulate your questions. What is it that you want to know? And
Right.
I will tell you, and I will give you the guides and where you should go read certain things. And be it we have another conversation, we have another conversation. So,
Mhm.
I mean, this is why over the years I have several of the same questions over and over again.
Yeah.
So this is why one makes webinars. I mean, this is why I made
Right.
the vaccine webinars, because they're 5 hours worth of content. I only have an hour with somebody. Um,
Right.
so there's only so much you can talk about. But the webinars are intended to almost formulate more questions for you so
Mhm.
that when you make the decision, you know why you made the decision. Exactly.
Exactly.
And so if
Mhm.
someone questions your decision, it's like, well, this is why XYZ.
XYZ, right. Yeah. So you can
So
talk
this is
to the person that's administering the
mm,
vaccines or
mhm,
whatever.
exactly. I mean, you need
Mhm.
to, because I don't think anyone should ever make a decision based on fear, ever,
Right.
or
Especially when it comes to
ignorance.
your child.
Of course, of course. I mean,
Yeah.
you're going to research several things for your newborn. This is one of those aspects that perhaps you need to research. I mean, or you don't, you know exactly what you want to do, and that's how it's going to get done. Great, great.
Yeah.
But it's for those that are like, I mean, these, internet is a sea of information.
Right.
And
Yes, it is. Yeah. Google is not a doctor.
no, it's not. And so, you're just, it's really, it becomes too overwhelming, and it really can feed that fear monster for you if that's sitting on your shoulder. So
Right.
I
Yeah.
try to really slice through all of that, and let's just get down to the nitty gritty here. What is it that you want to know? And with the
Mhm.
webinars, they are quite technical. I did
Mhm.
that on purpose because this is a conversation that requires evidence. When you're going to make your decision, you
Mhm.
want as much evidence as possible. And so, the first webinar is just infant immunity that,
Right.
I
Yeah.
talk about. And I think that we should be more, an aspect that we need to understand a bit more of how infant immunity works, because it's
Yeah.
different than a full
Yeah.
grown adult.
Right, which is
So,
a great segue into
right.
talking about infant immunity. Dun, da, da. Yeah, that was a great background. I think this is such a hot topic for us to talk about today, especially in our current times. But also, like as you said, having the information allows people to make an informed decision that they feel really good about. And like you said, who wants to make that decision out of a fear? Because then you are always second guessing that decision, right? If it doesn't come from the heart and from the knowledge, then you're going to end up probably with a poor outcome.
Yeah. Oh,
Yeah.
totally. Yeah. Yeah.
Um, so let's talk about infant immunity. Can you just like from the basics kind of describe what infant immunity is to our listeners? What kind of immunity, they come into the world with?
Mhm, mhm. Yeah. So infants, I describe them as they're a blank computer when they arrive, and
Right.
they really have to start learning their environment. And
Mm-hmm.
what nature intended was they're born with, so we'll get a little bit technical here, but they're
Yeah.
born with what's called Th2.
Mm-hmm.
And there's different arms to these naive CD4 cells that are going to differentiate into Th1, Th2, Th17,
Mm-hmm.
Treg, and there's some new ones that we're learning. They all have their own role. And so this is the aspect of the immune system of they
Yep.
have different parts to deal with different things. And so we have, our army, we have our navy, we have all these different pieces, right? And so when it comes to the two huge arms, we've got the innate immune system, which
Mm-hmm.
is I respond quickly. I don't really know if it's a problem or not, but it
Right.
doesn't seem supposed to be here. So you can think of these Pac-Men just going around and eating things that seem foreign. That's your innate immune system.
Mm-hmm.
And that develops in the womb. And
Mm-hmm.
so what's even interesting is that the web between the fingers,
Mm-hmm.
macrophages actually eat out in between. So that's our innate immune system, is
Yeah.
they like little Pac-Man eating between. So then we have our fingers are not attached anymore. So
Yeah. That's
that's your
so
innate
cool.
immune. So cool.
Yeah.
Then when they're born, so then we're getting to the other side of the immune system that's responsible for making antibodies, the
Mm-hmm.
adaptive side. That's our memory side. Either
Right.
kill it completely or let's remember. And
Right.
so what they're born with is they are born with the ability to make antibodies, but more so to allergens, that
Mm-hmm.
piece of making antibodies. So mama's breastfeeding, she's eating all these different foods, and
Mm-hmm.
the baby's body is building a tolerance to those things, self from non-self. So
Right.
that's a banana, and that's wheat, and that's dairy, and all these things that it's like,
Mm-hmm.
okay, so the computer is learning the code of what's either self from non-self.
Mm-hmm.
So that's early on in the beginning. And so when we vaccinate around 2 months, we're asking the immune system to turn on or push the Th1 side.
Mm-hmm.
And so Th1 is responsible for making antibodies to viruses and bacteria.
Mm-hmm.
So vaccines will use adjuvants. And
Yep.
adjuvants primarily are going to be aluminum to stimulate the immune system. And aluminum in vaccines is different what is found in food. And I
Mm-hmm.
go in detail of what I'm talking about third webinar,
Oh,
because
great.
I really want to dispel aluminum, and let's get down to the actuality of aluminum in food versus what's in vaccines. Because some people might think that that aluminum in my food could act as an adjuvant. You could think the
Right.
other way about
Right.
it.
Exactly.
So, which it does not. It doesn't. It doesn't
No,
elicit an immune
not the
response
same.
in food. It does,
Which is a good thing.
which is a good thing.
Yeah.
So, because then you would be eliciting an immune response all the time, because
Right.
we are exposed to aluminum a lot.
Yeah.
But it's a different form of aluminum. And so it's water soluble versus the form of aluminum in vaccines, that which elicits an immune response.
Mm-hmm.
So that's the point of why it's there. So the immune system responds, which it does at 246. It does
Mm-hmm.
respond. There are antibodies made, but a very weak response. So at 2
Mm-hmm.
months, we have antibodies that are made, and then they subside, and then 4 months, and then they subside, and then 6 months, and then they subside.
Mm-hmm.
So then we vaccinate at 12 months. So the around 9 to 12 months is when infants make a stronger ability to seroconvert, meaning
Mm-hmm.
an antigen, make an antibody. That's more of the time frame of where the research is showing that it's more robust
Right.
and lasting.
Yeah.
And so then we do a 12-month. So usually whatever you've done at 246, you're doing at 12 months, or you're
Right.
doing 15 or 18 months. It depends where you live in the world. Your schedules are a little bit different.
Right.
But usually it's 246, 12, 15 or 18 months in there. And then you're doing vaccines typically at 4 or 5 years of age is your next dose of certain ones. So this is sort of the ebb and flow of the antibody production.
Right.
And then we get more sustained. And so people say, well, why do we do it so early? And a lot of countries follow how the US has done things.
Right.
And so around 3 months is when it's been found that mamas have stopped breastfeeding. Either they can't breastfeed anymore, or going back to work,
Right.
maternity leave is short. So all these different factors leaving the baby vulnerable. So this is where the 2 month, 4 month, and 6 month will come in, because they'll get
For protection.
protection that way. Because breast milk is to provide antibodies via passive immunity.
Right. Yeah.
So then they provide antibodies for protection that way if mama has them. So then that will protect them that way. So yeah, I mean, the knowing that infant immunity is developing, they aren't born with the ability to know everything. There is a
Right.
gradual development. I mean,
Yeah, we're still developing now, even during the pandemic.
yeah, I mean,
Yeah.
know that, I mean, in every which way or form, an infant is developing. I mean,
Right.
from gut function, neurologically,
Mhm.
literally growing. So it's developing in so many different ways. And so the
Totally.
immune system is a big one, where they aren't born knowing exactly what to do. But the baby makes antibodies more precisely and more robustly to allergens from the get-go.
Right.
And then that starts to level out. 6 months, naturally Th1 is coming in, and then the immune system is fully developed by 2. The gut secretory IgA is pretty much on board by 3 months.
Yeah.
So yeah, so there is a progression in terms of its development, because some people, and I've, within the medical community, have sort of kind of give this off the cuff, saying, yeah, they're totally developed. They can absolutely, no
Right.
problem, make antibodies, but sure, to allergens, but
not to everything else.
not to everything, and really well.
Yeah.
So we do have to understand, and I think it's important as physicians,
Totally important.
to understand that physiology of infants.
Mhm.
And then so I go into the why, and what are, because there's certain cytokines that aren't being secreted, and therefore that activation doesn't happen, and which ones those are. And so that's where the technical piece comes in.
Right.
So that's sort of the negativity that I've gotten from the webinars is that piece. But I want people to be VIP in their understanding. I
Right, which
really
is
want them
important.
to
It's
be.
cool to learn different things we don't know about the body. I always find it
Mhm,
fascinating. And
mhm.
patients and listeners do too. It's like, oh, what's that? People might know what a cytokine is, and now they can like look it up or watch a webinar and learn more about it.
Totally.
Yeah,
I mean, the beauty now is, you can, watching webinars and listening to this stuff. I mean, it's much easier now than having to open up a textbook and read it. So, you
right.
know, I try to synthesize that part. I mean, I'm still learning too. I do
Yeah.
not know it all. I'm not an immunologist whatsoever. So I'm trying to learn from immunologists and
Hmm.
taking those pieces, putting them together in a more succinct way. So it's like, okay, all I
Right.
want to know is just this
Little
piece
narrow
right,
window of
little
vaccinations, right?
window.
Yeah.
And so then you have the language, you have the words, you have the jargon, and then you're just building upon
Mm,
your understanding and awareness.
yeah.
Because I think we can we have the ability to know now. And so the
Hmm.
accountability more
Right.
upon us as
Yeah.
parents, of our own health, of whatever it is,
Hmm.
taking accountability rather than feeling that, that hand holding piece really, I hold my patients up. I will hand hold them, but I want them to take that independence and read and
Right.
learn.
Yeah.
And I want you to do that work. I want you to do the work. And that's
Well,
the
learning,
frustrating.
right? Yeah. Learning is part of the work.
Learning is part of the work. And
Right.
so
Hmm.
this is where, when parents come in and say, what do I do? I'm sorry. I'm not telling you what to do. I mean, this is, you need to have an awareness of what you don't know. What do you want to know about? Vaccines is a huge topic. There's so many elements to it.
Right. Yeah.
Like, it's massive. I mean, because we can take little bits out of it and we can just go down that path of talking.
Right.
Oh, you know,
The eternal pass on the web, right?
yeah. Oh,
Yeah.
yeah. I mean, I had cut down on the webinars. I mean, I thought I was going to be able to do about an hour per segment, but no, I mean, I did 5 hours. It's not exactly where I was intending, but, and
You're
I
like, this
had
is a
cut
lot of
out
information.
a lot of information. I had
Yeah.
cut out lots of slides, which is why I'm going to make another one, a bigger one. And this one will be
Or
the
like
little
comprehensive.
one,
Yeah.
way more comprehensive, because I mean, I'd like to get into, I talked a little bit about pregnancy. I want to get more into viruses and
Hmm.
bacteria, just what are viruses and what are bacteria, and
Right. So
especially
people understand.
now
Hmm.
to
Yeah.
understand the difference, because they are totally different, viruses
Right.
and
The way
bacteria.
our body perceives them is totally different.
Exactly.
Yeah.
Exactly.
So
So,
back to the immunity, is there a specific for infants, a difference when a mother has a cesarean versus a C-section? Is there a specific, um, a different a different immunity that the infant develops between those two? Is it different?
so vaginal versus C-section.
Yeah. Hmm.
So when you're born as a vaginal birth, I mean, of course, then we're talking about microbiome exposure.
Right.
That's certainly going to be different. So in terms of, you're born through the canal, and you're going to get a wash of bacteria, eyes,
Hmm.
nose, in the mouth. And that aspect will turn on, interestingly enough, genes within the gut, because the baby's
Right.
body is like, okay, I'm going to be receiving food now. So then you get colostrum, you get to seal that.
Yep.
And then you start breastfeeding. And so whatever mama has, if her gut microbiome is healthy, then the baby will be receiving those via the milk. So there's dendritic
Right.
cells that will capture those good bacteria and then go within breast milk. So the baby does receive. So that is then helping gut function and
Mhm.
immunity that way, and ensuring that there is a good amount of good bacteria.
Right.
Um,
That we
and
need
if-
or the baby needs.
yeah,
Hmm.
from the beginning, because the first 2 years of life is an imprint of microbes that the gut needs to recolonize. There is an
Yeah.
imprint phase for the first 2 years. So this is where this is if baby is born at home, and so the likelihood of having high abundance of, from staph exposure is a lot less versus if you're born in a hospital, that exposure is much greater.
Right.
And that has been tracked and found from babies that are
Makes so
born,
much sense.
from home to hospital to C-section. So this is where the vaginal swab comes in, which
Yeah.
I let my pregnant mamas know if you're going to have a C-section,
Yep.
then doing the vaginal swab, which is inserting some gauze into the vagina before a baby goes through C-section, pull that out, put in a little bit of water to saturate that whole thing. And then you put it over baby as a result, and you inoculate them that way.
So they're having that good bacteria enter the system.
Exactly. So that, because it's all about optimization of the body,
right?
The terrain, right from the get-go. And trying to do as least amount of invasive things as possible, and allowing nature to do as nature intended.
Right.
And then, if you're and what's interesting about the vaginal swab part is they compared C-section, vaginal birth, and then C-section with the vaginal swab. And the C-section vaginal swab babies had a more robust gut microbiome than the vaginal birth babies.
Wow, that's amazing.
So it's like, okay,
maybe you should do both.
Do both.
Yeah, right. Yeah.
Because what that means is looking at things like allergies and eczema. And so there was less of that, which is kind of a teach to dominant in terms of immune system.
Right.
There's less of that in those that have a more diverse, more stronger bifido-lacto strains within the gut for those babies. So that difference there, because when I have vaccine consults, this is the stuff I want to know.
Right.
C-section versus vaginal, breastfed or bottle. And then with that, are they on vitamin D? Is there a bit of zinc in there? Is there probiotics in there? And if not, vaccines aside, this is then something that I want to make sure that we're optimizing the health of your baby. These are the things that we should be doing regardless of your vaccine choice, these things. And then moving from there is, okay, you're going to vaccinate. Well, evidence around vitamin C to probiotics, even helping with the efficacy of the vaccine is probiotics, but then a lower amount of vitamin C with vaccinated babies has shown a bit of an issue. So this is where vitamin C comes in, and it goes to mama via breast milk, or we can put it in the mouth, different forms, or in the bottle. Like, we get creative in how the baby will receive it. Right. So these is part of the pre and post support before vaccines anyways. And then, we get into the conversation of Tylenol, which is something that I really recommend no one ever does before a vaccine and after a vaccine. And there's two reasons. And one reason is it can lower the immunogenicity of the vaccine. So it lowers the efficacy of the vaccine.
So what was the point then, right?
Exactly. So when we talk about fevers and pain, I mean, that is when we try and use other things other than Tylenol to support baby. And it also, there's some really good literature around with acetaminophen. Acetaminophen is glutathione dependent to break down. And so if that pathway is not doing so well, or you have low amounts of glutathione, then you get to have a really highly toxic metabolite floating around that is not good. So glutathione I put in also in the protocol, because if you go to Tylenol, sure, it's almost like if you take antibiotics, you take probiotics. If you're going to use Tylenol, you use glutathione. That's just how it is. And so if all you got in the house, you're like, my baby is uncomfortable, then use it. But then you have the knowledge of knowing, okay, well, you should have glutathione on board and use that one, and all good. So those kind of conversations too around if we're doing them within infancy and what we should do and whatnot. But certainly the C-section vaginal plays a role in immunity for sure. And then if you have had a C-section and didn't vaginal swab, it's okay. Then we get into doing probiotics.
It's not like everything's going to fail.
There is a solution. It's okay. There is a solution. So
because people don't know. You could go to the hospital and have planned to have a natural birth, and then it doesn't
Yeah,
always end up the way
that's
we
what I'm saying.
plan, right?
Exactly. So having that on board,
Hmm.
then great. So I use probiotics all the time with kiddos.
Yeah.
Even mine that were born at home in,
Hmm.
in a pool. Yeah, they get
Yeah.
probiotics right from the
Yeah.
get-go and still do.
Yeah.
When you get down the rabbit hole of the microbiome,
Right.
you would know
That's a whole
why.
nother podcast.
A whole other podcast.
Right. Yeah. We could talk about that one for a long time. It's a
Oh
topic,
yeah.
popular subject too.
Oh yes. Yeah. Essentially, we do probiotics. That's
Right.
essentially
That's
the
right.
end.
That's
That's the
it's
end
a
point.
given.
Yeah.
Totally. Okay, so
Um,
it sounds like that when a vaginal birth versus cesarean, there that one of the key things you want to make sure you're doing is having that vaginal swab ready to go so that you can help the baby's immunity start to get ready and or activate it is a great word for that, I
mhm,
think.
mhm,
Mhm.
mhm. So
Um,
yeah, I mean, this is where either now, I mean, there's only I think allowed one person in the delivery room. This is
yeah,
where probably the dad would do it. I mean, you have to have a conversation if you have a midwife or an OB. It's
right.
not part of their scope of practice, and because there's a bit of liability if you're dealing with group beta strep, there's that conversation that comes
Hmm.
with it. So having that conversation weeks in advance,
Right.
um,
Prepping.
prepping.
Yeah.
If we're going to have a C-section, then can we do this? And
Yeah.
there's great validity. I mean, the research is coming out. It hopefully would become common practice in 5 to 10 years,
Yeah.
and it'll be more acceptable. But just more research, they just need more evidence that this is something that we should do. But it's pretty profound. So,
Right.
anyways, yeah, yeah.
And what about the placenta? Does so some people will say the placenta and use that. Does that have a play a role in the immunity?
I would say not in the immune system. I
Hmm.
mean, are you talking placenta encapsulations?
Hmm. Yeah.
Yeah. So that's more for mama. I mean, that's more
Hmm.
for nourishing her is the reason
Right.
for doing that, or milk supply, healing. But in
Hmm.
terms of immune system, I don't think plays much of a role at all
Yeah.
within the immune system, but more gut. And those nutrients that feed the immune system and support it. I mean, zinc is a big one.
Hmm.
Vitamin D is a big one.
Hmm.
Vitamin C is a big one. And so
Yeah.
all these nutrients, because it's interesting when you look in the literature of deficiency of these nutrients.
Hmm.
I just did a big write up for my email list on zinc, and it's
Mm.
just even fascinating just reading on zinc and
Yeah.
how it helps from the thymus gland to natural killer cells to T lymphocytes, and
Hmm.
showing those that had deficiency of zinc and had an upper respiratory tract infection versus those that were deficient in the outcome. So, because I always think about infections as we all get sick, we all get exposure to things.
Right. They're in
It's
our
what happens next.
environment.
Yeah, I mean,
Yeah.
it's what happens next. You
Exactly.
can't
What's the
prevent.
response?
What's the response time? I mean, you can't prevent really, unless you don't do anything, you don't leave your house, you're not exposed.
Right.
The
You
only
live
way
in a bubble.
live in a bubble. The only way to prevent getting an infection is you're not around that microbe. That's it.
Right.
It's not within your existence. It's the only way you prevent from getting it. It's what happens next after you breathe it in.
Right.
How do your
Exactly.
mucous membranes, how healthy are they? Your secretory IgA, the immune system, your GALT and MALT, how these things deal with it.
Yeah.
And then if that infection breaches your GI tract and gets systemic and gets
Hmm.
in, then what happens next? How does your
Yeah.
body deal with that? Do you
Right.
have the army to deal with it? Do you have a strong innate immune system? What's up with your adaptive side? So this
Hmm.
is why we support the immune system with
Hmm.
nutrients, showing that if there's a deficiency in these nutrients, there might be a possibility that your outcome could be worse as a result.
Exactly.
We're
Yeah.
all at the same we all have the same capability of receiving these infections, but
Hmm.
who is susceptible
Right.
for once we get it, lead down the path of, this isn't going to be a good outcome. So
Right. Yeah. Yeah. And
yeah, and
everybody's
so
different. Hmm.
everyone's different. I mean,
Yeah.
yes, there's different risk profiles.
Hmm.
So it's having that knowledge base to help reduce that risk for you. understanding them. So yeah, when you go down and read these about each individual nutrient, it's pretty fascinating.
Totally fascinating. I know I love zinc too. It's a really interesting one. It does so many roles with the immune system.
Yeah.
And a lot of people have been being more deficient in it, which I find fascinating too. Like with vitamin D, it's like, okay, well, why are we having this shift in our system? Are we more
Mhm.
susceptible? Are we not getting the nutrients? We're not absorbing? I mean, of course, that's another whole podcast
Oh,
too. Yeah.
totally.
Yeah.
Well, even it's interesting because having lived in Dubai, having lived in Singapore,
Hmm.
vitamin D deficiency was a huge issue even within those two locations.
Mm.
And it's like, why is vitamin D deficient in a sunny place?
Right.
Well, in Dubai, I mean, it gets hot in the UAE. I mean, the Middle
Yeah,
East gets
super
hot.
hot.
So you're avoiding going outside for
Right.
one.
Yeah. I think I'll stay inside for this one.
Totally. And so in those, I mean, within Dubai, I mean, Emiratis will wear usually, the types of clothing that
Mhm.
they wear, a discharge and whatnot, is
Right.
covering the head or is covering the face or covering the arms. So you
Hmm.
are blocking the ability to get the vitamin D as a
Yeah.
result. So that is why as well. And in Singapore, within Southeast Asia and Asia cultures, of course, is maintaining that white color of the skin. And
Hmm.
so then you're going to be having a lot of people use umbrellas,
Right.
or visors that will cover the
Hmm.
cover. So there's, if you're going to cover, you're not going to receive vitamin
Can't
D,
absorb if you're covered.
can't absorb it.
Yeah.
And then of course here being in North America, well, we just have less
Right.
of
And
the
a lot of people
sun.
work inside too.
Yeah.
Yeah.
So I
Hmm.
do think that it, it's pandemic of vitamin D deficiency, shall we call it? It's a
Yeah.
vitamin D is something that you should have checked, you should have tested, you should know
Hmm.
what your levels are. In kiddos, I don't. I mean, it's a blood draw, so it's a little bit
Right.
invasive.
Yeah.
Um, so
Too
we
much.
a little bit too much. So we just
Yeah.
do vitamin D is what we
Right.
do.
Yeah.
Um, and then we keep within a range that's healthy.
Healthy for
Um,
mommy and baby. Hmm.
yeah,
Yeah.
that goes from there. So
Yeah, perfect. Yeah. So let's switch over and talk a little bit more about vaccines. And I think you talked kind of about the basics about the antibodies and the antigens. Can you give like a brief summary of the diseases that vaccines are geared to protect against? I know it's a kind of a wide variety, but people can also go to your webinar and watch more, but just like the brief diseases so people are familiar with what they have in store for
sure.
them.
Sure. So the infections that we vaccinate for, so 246, depending where you live, will either be a 6-in-1 or a 5-in-1, and then a couple others. So
Hmm.
we've got diphtheria, tetanus, pertussis, polio,
Hmm.
hepatitis B. Here in British Columbia, we do that at 2, 4, 6 months. The States does Hep B at birth.
Yeah.
Other provinces do them in grade 6 is the first time they do hepatitis B. And then also there's Haemophilus influenza
Hmm.
type B within one vaccine. So either it's 5 or it's 6. Then we've got pneumococcal, which is the PCV13. And then
Yeah.
we've got meningococcal, meninge C, and then rotavirus. So
Yeah.
all of those will be done in 2 months. Then at 4 months, you repeat, but you don't do meninge C. 6 months, you repeat, but you don't do meninge C or PCV13. Then you get to 12 months and you're going to do
Mhm.
MMR and chickenpox with meninge C and PCV13 again at 12. In amongst that might have been a flu shot.
Right.
Then you're hitting 15 or 18 months where you're repeating, you're doing a 5-in-1 again. So that's the diphtheria, tetanus, pertussis, Hib, and IPV, polio. And then you hit 4 years
Mhm.
old and you're doing your MMR again with
Yep.
chickenpox. So yeah, you're there's not a lot of infections.
Mhm.
You're just repeating them over and over again,
Right.
is what you're doing. So yeah, you same ones that have been for, there was, if you're born in the 60s, I'm
Mhm.
just going to go the 80s because I can't really remember the 60s very well, but in terms of the vaccine schedule, but the 80s simply was the DTaP, that one vaccine, and OPV,
Mhm.
oral poliovirus, which we don't do anymore.
Right.
And then at 12 months was the introduction of the MMR vaccine, measles, mumps, rubella. And then in grade school, you're doing Hep B, and then you're doing the quadrivalent meningococcal vaccine. And that was it. That was the 80s.
So that's a huge shift in
It's a
the
huge
amount
shift, big
of
shift. The amount
vaccines.
has shifted. Yeah.
Yeah.
In terms of the amount.
So
So,
that's probably a
and
big
that's
question you're asked, right? Is
sure.
like, like, so why do we need to have all of these vaccines in the beginning? And then the other question I'm sure is that our listeners have is, what's that look like if I want to, one, stretch
Mhm.
that out? And what's the benefit of that for, my baby? And also for the timing of things right now with the pandemic, like, do parents want to take their child to the
Mhm.
exposure of being in a medical facility that frequently?
Mhm. Yeah, yeah. So all of these questions, I mean, so we'll talk about risks. What are your
Mhm.
risks of contracting these infections? From daycare, travel was one of them, but that's not happening.
Right.
House crowding, lots of people holding your baby, from
Mm,
those that smoke. So smokers increase risk for exposure of certain infections to
mhm.
infants. So then this becomes, okay, well, if the uncle is smoking, tell him to quit, and
Right.
probably can't hold baby for a while,
Yeah.
so these, it helps people make that change in terms of
Right. The
smoking. But
decision.
that is a level, and I know it to be cigarette smoke. I don't know about marijuana.
Yeah.
So we go through the risk living on a farm.
Mhm.
We go through all these risk factors as well.
Mhm.
um we need to understand the infections that which you're vaccinating
Right.
for. So
Mhm.
have an understanding. I mean, that's webinar 2, where I go through each of the infections that we vaccinate for in
Perfect.
infancy.
Yeah.
So then
Mhm.
let's talk about those. Now, where do you sit now? Like, where are you? Because a lot of these people are like, well, I'm not going to vaccinate, or I'm going to delay. And that's why they come to talk to me.
Right.
So okay, well, let's go through your algorithm of what's happening,
Right.
what you
Like kind of
understand.
the rule out kind of phase.
Yeah, exactly. And they're like,
Mhm.
okay, well, this and this and this and this I'm not comfortable with. I need to vaccinate. I'm like, okay, now we're going to talk about the vaccines. What is your
Mhm.
choice in terms of the vaccine? Do you have to do a 6-in-1? What about a 5-in-1? There's a 4-in-1. It depends on where you live in the world in terms of what you have
Right.
access to. So then we go through the schedule of what's available and the
Mhm.
choice there, that you want to do, and then the age of the child, which is licensed for them, at certain ages.
Right.
Then if need, then here in BC, I refer people to children's to speak to a vaccine specialist. Yeah.
Oh, nice. Yeah. That's great. And so from resources, since we're kind of talking about that now, we could go ahead and what are some great resources people can go to if they're looking for specific information for their area? Like here in the States, the CDC is a great reference point. I guess, it's got like the schedule information. So is that like a place that the listeners kind of go to first? Watch your webinars and then go to their local CDC information
Yeah.
center and find out about the scheduling.
Yeah, I mean, here in BC, CDC has a lot of information in terms of, infection numbers and decline,
Mm,
and what are the numbers now, and this
right.
kind of, that's helpful for that. I put people towards certain books to read.
Mm,
And then with the webinars, the point is to weed out what is it that you want to know or you don't know.
right. That's true. Like
Um,
you narrow down the questions.
I mean, I really like The Unvaccinated Child, that's written
Hmm.
by 2 naturopathic doctors. And so they go through the infections, which is fascinating, with pictures and stats. And
Mm,
then what could you do if your child got an infection?
right.
Because even though you've vaccinated, there's still a chance to still get infected with that
Right. Yeah.
infection.
Vaccines aren't like
So
100%.
they're not 100% effective. They're
Right.
not.
So we talked about that. When should parents really start thinking about vaccines? Is there, is it when they're starting to think about having a baby? What's that first like thought bubble they should start researching?
Such a good question. And it's within pregnancy, because I do want mamas to, it's so new if you're a first time mom and you're pregnant, to weed out the pregnancy things that you should know about, what you're going to do for your labor. Get all of those things. If you're going to have a midwife, an OB, all of that settled there prepped.
Mhm.
And then right in about, late second, third trimester, let's start talking about vaccines for baby. And so, because if you're in the States, it's 2 months, it's at birth is your Hep B vaccine.
Mhm.
In Singapore, it's Hep B and the BCG right at birth as well. So that's where we can talk about it before the day baby is born. Now, of course, here in Canada, well, in British Columbia and almost all of the provinces, we don't start till 2 months.
Yeah.
So I do like mamas to sort of get some of that knowledge base within pregnancy,
Yeah.
because before baby comes to then, because it's you're listening and reading and hey, I had brain fog
Right. It's
once
common.
my kids were
Yeah.
born, and I was not sitting down to listen to anything.
Right. You're too busy
So
at that point. So
I'm too busy at that point, and like I just can't. I just want to
yeah.
sleep.
So make the
And
decision ahead of time with your
so yeah,
partner
I mean,
or
making the
whoever.
decision, because then you can, if you've got your thoughts and notes down
Mhm.
before baby, then you can revisit and remind yourself of what all the work you had done
Right.
previously.
Yeah.
Right. And things might change. Things might change once your baby is born. So you sort of formulate your thoughts, your understanding, your questions. I've got a lot of pregnant mamas that will come in and we'll talk first. Then
Mhm.
baby born. They've got a couple months before, the 2-month shots are coming.
Right.
They come in and we have another conversation. They're like, okay, so I was reading this and reading that, and what are your thoughts on this? And so then we start chatting. And so,
Yeah.
and then a lot of times it's, which vaccines can we break up? Which ones can we do? Can we do single this? Can we do single that? I want to do this one. I want to do that one. And
Right.
that's where I get to formulate the schedule for them, because they now know what they're going to do. So like, well, then
Mhm.
these are the vaccines that you need to do as a result of
Right.
what you're going to do. And this is what it looks like. These are the ones, because you think, well, because other countries do different things or have the ability.
Right.
The US has so much access to different things because that's where a lot of them are made, and that's where the pharmaceutical companies are.
Mhm.
So we only have what's licensed for Canada. That's all we have. There's no
Right.
bringing in. I can't bring in a vaccine of choice.
Right.
No, it works
Yeah.
that way. So
Right.
then that formulating that mind, that's how I have people formulate their thinking process, risks, infections,
Right.
and then which ones are we going to do as a result, and as a result of that.
Prioritize them. Mhm.
Yeah, exactly. And then we
Yeah.
know which vaccines you're going to do as a result. And yes, they're going to have to be in a combo,
Right.
or not, depending. I got a lot of families that come in, the kids are unvaccinated and they're 3 or they're 6 or they're
Right.
18. And
Yeah.
so it's a little bit different in terms of what they should be doing at that point. I will do titers for older children, seeing
Right.
if they've had previous exposure or they did have vaccines, and we check to see if they have any immunity to those.
Can you explain what titers are, just to backtrack there for our
Course.
listeners?
So,
Mhm.
of course. So titers are going to tell me if the body had made antibodies to the
Mhm.
antigen, IgG status. And
Mhm.
so IgG, or titers, or teeters, as some say. So we can, here in BC, we can test for measles, mumps, rubella, hepatitis B, and chickenpox.
Mhm.
So, I just had a family last week. Kiddos had all of them, and they were looking at doing maybe a couple boosters. So we did blood draw to see if they have that immunity, if that
Right.
status. And
Yeah.
so then we'll make a decision based on that. Now, with the caveat, of course, is that titer testing is not 100% either, meaning we can have some false negatives,
Right.
meaning they could actually have immunity, but it's not showing. So it's not, no test is 100% anyways, no test on the
Right.
planet.
Yeah.
So there's going to be, a
A
level
variant.
of a percentage where, yeah, it's
Mhm.
unfortunately, maybe you do, and you didn't make any antibodies. Maybe you don't, but this is the only tool that I have that I can use to tell
Mhm.
us.
Yeah.
So quite a few families where we do that. Do they need their 4 or 5-year-old booster, or they have just had the vaccine?
Mm-hmm.
And, 2, 3, usually 4 weeks later, we'll test to see if they made antibodies to it, to
Yeah.
see.
See if it works.
Adults want to know, I mean,
Right.
do I have immunity to these things? We pretty much have a large unvaccinated adult population. I think people realize
Yeah.
you know, we want to pinpoint children as the unvaccinated, when I want to turn the tables and then pinpoint also to the adult population to be
Right.
part of that conversation. It's
Mm-hmm.
not just infants. It is
Right.
also you adults,
Mm-hmm.
that if you haven't done your booster shots as the schedule has noted, you
Right.
yourself are unvaccinated.
Right.
So, you're gonna do something about that, or at least you're gonna change your narrative and your dialogue, and only pinpoint children as the only ones around that are unvaccinated. No, no, no.
Right. Yeah. There's a
You
lot of
have to have
people
that.
who don't do their boosters.
Sure. So you
Yeah.
do have to sort of point the finger at yourself, as
Mm-hmm.
well as being part of the pool of unvaccinated people,
Mm-hmm.
unless you want to get your titers done. And see, we can't check everything, though. I have no
Right.
idea about Hib status or pertussis status,
Right.
polio status. I have no idea. I'm unable to do that. And
Right.
it'd be great if we could. I'd use it.
Yeah.
People, if it was a paid service, people that would pay.
Right.
Have that knowledge base. So
Yeah, maybe that will shift coming up and soon as we're moving into a new era of medicine.
yeah. I mean, if there's someone out there that's doing that, awesome. Let me know.
Right. Right. I know. Yeah. Well, we're putting it out there for someone to
I will
develop it.
use your company, your lab. So
Yeah.
but yeah, so these are
Mhm.
that part. I mean, along the lines of testing, even talking about genetics
Mhm.
too. A lot of people ask about MTHFR. I mean, it is
Right.
a big topic. I mean, and I see probably because it was
The
the
super
first
gene.
one, the super gene that everyone talks about, and everyone
Right.
kind of has a little bit of understanding. But in the world of vaccines, unfortunately, I think it's very narrow-minded to only pinpoint one and
Right.
say MTHFR, I'm heterozygous, or I'm combo hetero equals I cannot vaccinate.
Right.
And that is just incorrect way of thinking. I don't even know how that you could even say with MTHFR you can't vaccinate. I don't even know
Right.
where that comes from.
Yeah.
And so, because I have a lot of people saying, well, that means I can't methylate.
Right.
No, you can still methylate. It still works.
Mhm.
It doesn't work as well, but you got a whole lot of other things going on. So with vaccines, MTHFR, I'll put, as something to consider.
Yeah.
That is not the kingpin, though.
Right.
What we are talking about is inflammation and those inflammatory off switches. Can
Right.
you or can you not? And then you can even get into like mTOR. So
Right.
other ones that when we're thinking about immune activation,
Yep.
immune response, and what happens after that? What is the cascade that occurs?
Right. The
I mean, we
downline.
can talk about, surgery to a car accident, a big hit to the body in terms of response.
Mm-hmm.
Some people, that was no big deal. I healed, I'm fine. I don't have any extra pain. Nothing's, we're good. So your inflammatory off switches are really good.
Right.
Versus someone else that experiences something like, why is this happening to me? And that is where my experience from day one working in Singapore is I wanted the why.
Right.
And so then how do I mitigate that if I need to? Because I want to know the why. I want to know how this product works. I want to know what's in it. What does it do? What are the mechanisms?
Mm-hmm.
And what about genetics? Does MTHFR play a role or not play a role?
Yeah. And what other genes do?
What other genes do? And
Mhm.
so this is the journey that I've been on, and trying to put all of these things together in sequence of like, okay, that person, and I get, information from so many different people that have their own
Right.
segment within this conversation.
Mm-hmm.
I'm trying to put all those segments together.
Right. In one book, in one little section.
Exactly. I think one day there's a book for sure.
There's a book in there. It's
There's a book
formulating.
in there.
It's processing right now.
Totally. And it is. giving I give lectures at conferences quite
Mhm.
often. And, I can, I'm only allowed 90 minutes or 60 minutes or 30
Right.
minutes.
And you're like, that's not enough time.
Barely said anything. There's so
Right.
much to say, but of course that's where a book comes in, because I think
Right.
that, I've got people that give me I'm always asking for feedback,
Yeah.
always, like, please give me your insight. What are you thinking about
Mhm.
this or this mechanism, or what's happening here? Why did that happen? When you have a vaccine and you have a fever, sure. I mean, you're asking the immune system to respond to an infection.
Right. So
So
a
almost
fever is okay.
expect a fever to happen, like almost expect that. That's
Right.
part of the process as
Yeah.
well.
Yeah.
This is where I'm like, please, let's talk about Tylenol, because that's part
Right.
of
We
the
don't
whole
want to
conversation.
suppress it.
Don't suppress it. I mean,
Right.
fever in itself you could have a podcast on fever. I mean,
Right. Exactly.
beautiful. It's important. The
Yeah.
body, it's what nature intended. It's there as a safeguard. It's important. Try not to get rid of it right away.
Mhm.
Monitor. So, I mean, that comes in with that piece too with parents is
Yeah.
what do I do when they get a fever? Okay, well, let's
Right.
talk. What happens when? Okay, so this is what you're going to have in your cupboard. Number one, number two, number three, when it happens, you will use
Right.
this or this. And so those are the kind of things that I like to go with parents. So you don't
Mhm.
feel when you vaccinate your child still can get a cold, a cough, an infection. Know
Right.
that it still happens, and it
Right.
will
And
happen.
you want it to
So
happen so they can like
you
be
want to
able
happen.
to have an immune response.
Right. I mean, the things that we vaccinate against, so we've got Hib, pertussis,
Mhm.
meningococcal,
Mhm.
measles, mumps, rubella. We've got like about seven that are infectious communicable infections.
Right. That could be deadly.
I can breathe on you and you
Mhm.
could contract it,
Right.
versus you can't contract Hep B from me by sitting beside me. You
Right.
cannot.
No.
You can't get tetanus from me at all. There's no such thing as communicable
No, that's not one.
at all. So then even that part is like, well, what about tetanus? Well,
Yeah.
what about tetanus? It's a spore in the ground.
Right.
So it's
You have to have
not
a rusty nail or something.
right. So it's demystifying those things of we only vaccinate for very, very small amount of pathogens on the planet.
Right.
A very like a tiny amount. When you start understanding the amount of viruses and bacteria that are exposed to in any
There's
one time,
so many.
holy Toledo. So it's like please, because I have patients, I think, feel
Mhm.
vaccinated, they're in some sort of very protective bubble from
No, no, no.
no, you're not. So let's talk about that.
Right.
Um, and so then that's like, okay, so you still have to know your child will get sick, and what are you going to do about it?
Right.
So then that having that empowerment of knowing what to do, what to utilize, and that kind of thing. So
Yeah, that's key. Mhm.
yeah,
Yeah,
yeah. So
so if
did
someone has a reaction to a vaccine, then there's specific things they can do in recommendations. And then also just like typical, cold and flu or whatever kids get, then there's
mhm,
also other things that you can do.
right. Right. I
Mhm.
mean, there is a 3-page table format for possible adverse reactions to vaccines that's put together by the BC Center of Disease Control.
Mhm.
So that is a handout my parents get every single time that we vaccinate.
Right.
Like, you know that this is, and because they're time sensitive, meaning some of these
Yeah.
infections or these adverse reactions could occur within 0 to 2 days, 0 to 7 days, 0 to 40 days. So this is, I put it upon them, like, you see anything, you let me
Mhm.
know, and I'm gonna deal with the adverse reaction reporting system, because there is one in place here in Canada and the United States and all over the world. There is an adverse reaction reporting system in place that it can be utilized. Vaccine manufacturers want you to use it. They do
Right.
want
They
you
want to
to,
know.
they want to know. This is how we know if there's a bad lot number, or
Mhm.
where rotavirus is pulled for some time for causing intussusception. This
Yeah.
is where the DTaP vaccine went from wholesale to acellular. So when there is obviously a trend of infection or adverse reactions happening, then we do something about it. But we
Right.
need the report in order to know that there is something to even be aware of. So I've never filled out an adverse reaction report ever.
Not yet.
So,
You're like, knock on wood.
wood. But I think it's because either we prep so well, or
Right.
I'm
You're
not sure.
prepared.
But we're prepared. We're
Mhm.
not using Tylenol. We are not
Right.
going there.
Right.
Tylenol, and I think Tylenol is a big problem. I think it's a
Yeah.
big problem,
Right.
especially use it before. And I just I think the WHO is going to hopefully one day, really push that public health, really stop using Tylenol.
Yeah.
But then you need to replace it with information. You need to replace it with what else would you use? You need to
Right.
replace it with something that have it as perhaps something that you might go to, but don't use it liberally and just be, before, and just use it after just
Right.
because.
Yeah.
Use it when need. With anything you use when need. You don't just use antibiotics just to use antibiotics. You use them when need, right?
So unfortunately, some people are using them like that, but that's
True.
changing, I think. Yeah, the information is getting out there better. Um, And so what are your, just as some final thoughts as we're wrapping up today, what are your thoughts about a possible like COVID vaccine coming on the market? Do listeners need to be aware from the infant perspective? And, do the, not just thinking about preparation for that. If there's something that comes on the market, we don't even know what that's going to look like yet, but is that a target group that the parents need to be concerned about?
Right. It seems that, infants and school, age children isn't the population that we need to be
Right.
too concerned about in terms of SARS-CoV-2.
Right.
And, with a vaccine coming out, I think there will be a level of more security that way of having a vaccine.
Mhm.
We want many components of our lives to get back to the way it was beforehand.
Right.
And, we want to be able to feel comfortable when we're with each other,
Mhm.
because we don't right now. And we want to be able to open up bubbles. We want to be able to have concerts again, to have all
Right.
these really
I
things that
know, I
we
miss
miss out.
concerts.
Yeah, I mean, to even parents be able to attend their own kids, lacrosse game. Sorry, that's a
Right.
Canadian.
Graduation
Graduation, all
yeah,
these things, hockey,
or a
football, all
funeral.
being at funerals. Like, we want to
Mhm.
be able to get back into having our social lives again
Yeah.
without this thick layer of fear. And
Right.
that is where I see vaccines as an insurance plan. It can
Mhm.
there's this level of security with it. So this is where the vaccine will allow for that.
Right.
We can come in, and those that want it get it, go for it. And
Right.
so and then we can move forward. We can, we went through SARS, we went through MERS, and now we're going through SARS-CoV-2, and want to get, it seems like every 5 years
Yeah,
something
right.
new
Something
pops
new,
up.
right.
So probably another 5 years when something new pop up, and who knows
Right.
what that's
Just
going to
the
be.
planet.
So yeah, it's
Evolution.
just how evolution is. And so that's how I see with, in terms of infants. No, they don't seem to be there. They,
Right.
based on numbers, the vulnerable demographics
Yeah, which
at
is
all.
good, I
So there's,
think, for them.
yeah. So that, then we just get back to basics in terms of
Right.
helping our kiddos, and leveling up in terms of diet for our kiddos. Lay off the sugar with your kiddos. And
Right.
that's even from like pot. Please stop if you are.
Mhm.
Reduce if possible, to juice. No need for juice either at all. And really increase the water content for your kiddos. If your kids aren't sleeping, which is incredibly important, then you
Mhm.
work with a practitioner that can help on the sleep piece, the gut piece, and then the immune piece. I mean, with kiddos
Right.
getting sick, I'm not worried about kids getting sick. What concerns me is the duration of the sickness. How
Right.
long are they sick for? And do they
Like for like a
roll into
month or
another
something.
months
Yeah.
of being sick? Is not, in my eyes, acceptable. Your kids
No.
get sick for 3 to 4 days, fine.
Right.
You
Stay
get sick,
home, rest
stay
up, go back to
home,
school.
rest up. You're eating them good, nutritious food. And if kids are sick and don't want to eat, don't force them. just make sure they have water on hand.
Right.
And if they roll into another one the next month, okay, but it's short-lived is what we're wanting for our kiddos,
Right. Yeah.
not turning
Chronic
it into a
illness.
chronic.
Hmm.
So then something is missing. There's
Right.
something missing there if it turns chronic. And that's when, of course, naturopathic medicine is preventative medicine. It's
Right.
functional medicine, integrative medicine. So this is where the knowledge is power. And knowing, well, what can I do to prevent this? We know
Hmm.
that it's coming. We know, Johnny gets sick all the time. So, oh, great. Okay. Well, how is gut health? How is
Right.
sleep? How's
Hmm.
nutrition?
How the
And exercise?
foundations.
All these foundations that seem really basic, but yet we're not actually doing them in the best that we
Right.
can.
We have the knowledge,
So,
but we're not using it. I think that's
using
common.
it. And even as adults, drink more water and sleep. I mean,
Right.
it's really that simple.
Yeah.
You'd be surprised
No, I'm
how
not.
well you
But I know that there's listeners out there that are probably surprised. Yeah. No,
right,
it's
right.
true. Yeah,
Get
I
to bed
actually
before
am always
11.
surprised. Like, yeah.
Yeah.
What do you
I
mean
mean,
you only sleep
sleep
4 hours a night?
Yeah, I mean
Yeah.
it's a big piece. So anyways, I mean that's
Yeah.
that's all about optimization in terms of, the just your child's health, and then the
Mhm.
optimization around the conversation,
Right.
and what is it that you want to do and why.
Yeah.
And going through that kind of conversation together. And yeah, I mean I hope that there's more of my colleagues to those within the vaccine world
Mhm.
allow for that space for their
Yeah.
patients to ask questions. And I've
Yeah.
never heard it from my patients coming from a naturopathic doctor. A lot of naturopathic doctors won't even talk about it, know that
Right.
going into it as well.
Yeah.
And some can't.
Right.
Really have to be very mindful of not really saying anything and just sending you to public health. So
Right.
know that that's not because they don't want to. It's because well, maybe they don't want to, but they can't.
Yes,
And
this is true. Mhm.
so this is where I work with a lot of other naturopathic doctors across the country, and I'll have consults with their patients, and then I'm in contact with their ND,
Mhm.
and then we work as a I'm as a duo. So
Right.
the patient has two NDs. I'm just answering and being that person for the vaccine stuff, and then their ND is dealing with everything else.
Yeah,
So
that's
it's been a
great.
really good relationship that way,
Mhm.
um, to work with patients, just to have someone to talk to. Yeah, yeah.
Yeah, wonderful. Well, thank you so much. I have one last question. I promise it won't be more than this. Um, so, if you had all the money on the planet, like an unlimited budget, what would you do with it to make the most impact?
Oh man, if I water supply to the world, clean
Water,
really
that's a
would
good
be.
one.
I
Yeah.
mean, when I think about infections and I think
Hmm.
about susceptibility of different demographics in the world, it's water is a big reason of why there's still big ill health in part of the world, water
Mm.
quality.
Yeah, that's
So
so
that would,
true. That's a good one. Okay,
I
yeah, I'll
mean,
fund that one.
please,
Yeah,
water everywhere. I
water
mean, I know
everywhere.
it's happening, a lot of companies do, but man, there's lots of other things I would do, but I think water would be number one.
Yeah, and well, water is key, like you said, to infections, but to just overall so much health, when
Yeah.
we have good water
Yeah.
and good food. Okay, great, Dr. Bean. It's been such a pleasure to have you today. And just so people can learn more about your knowledge about vaccinations and infant immunity on your website with your webinars, right? They can go straight to the
Yeah.
webinar button. And your website is drtaylorbean.com.
That's right. Exactly.
Great.
Yep.
And they can also follow you on Instagram to find
Mhm.
more about like what you're up to and all your cool posts. And if they want to
Mhm.
make an appointment with you, same thing, go to your website and they can
Yes.
directly book there too.
Yeah. Yeah. I'm at two different locations. You just put, booking online and it'll tell you the two locations. If you're international, you can email me and we can chat that way of how that works. Yeah, I work at two different clinics. So it's all
Great.
on there.
So you're
Yeah.
seeing in person and you're also doing like telehealth as
Oh, yeah.
well.
Yeah.
Great.
Telehealth is
Okay.
big. Telehealth is
Yeah,
big. Yeah.
right. Yes, exactly. Well, thank you so much. It's been such a pleasure to have you on today. And I hope that the listeners just learned so much. I did. And I'm fascinated to learn more. I think I have a new little thing to study, of course.
Well, thank you for having me on. I just appreciate people giving me the platform to talk about this and,
Yeah.
to share. And because I've seen enough in terms of people, their frustration around this topic, and
Mhm.
the fear to ask questions. I it's unnecessary. It's really unnecessary. I think, we as practitioners can level up and give that safe space. We can with any
Mhm.
other topic. This is no different. So
Right, exactly. I mean, not that it's a comparison, but cancer is a big one too. I think people, that's a great place for us to talk with patients about, like, because they don't, the knowledge is so spread, it's like there's so much information. So that's a kind
totally.
of a good place for people when they're talking about, like, well, how come you're not talking to me about vaccinations? Now there's a great resource you to go to.
Totally. Yeah, cool.
Yeah.
Totally. Awesome. Well, thank
Okay.
you.
Thank you.